So a baby who does not have enough vitamin K can start to bleed suddenly without warning, and this is a rare condition known as vitamin K deficiency bleeding, or VKDB. VKDB can be idiopathic, meaning that it occurs for an unknown reason, or secondary as a symptom of another illness or condition. Idiopathic VKDB is the most common kind, and virtually all cases of this happen in babies who are exclusively fed human milk. Secondary VKDB is rarer and occurs in babies with underlying conditions such as gallbladder disease, cystic fibrosis, or due to medication side effects. Most babies who have secondary VKDB are also exclusively fed human milk. So vitamin K deficiency bleeding can follow one of three patterns: early, classic, and late. Early VKDB happens in the first 24 hours of life, and it's usually seen in babies born to mothers who took medicines that interfere with vitamin K. These medicines might include warfarin or Coumadin, seizure medications, and tuberculosis medications. The bleeding usually happens in the skin, brain, or abdomen. Classic VKDB is also sometimes called classical VKDB. This would happen in days 2 to 7 of life, usually during days 2 to 3 after birth. This is when vitamin K levels are naturally at their lowest. And common bleeding sites include the gastrointestinal system, the umbilical cord site, skin, nose, and circumcision site. The official cause of classic VKDB is usually listed as unknown, but breastfeeding or insufficient intake of milk are major risk factors. Late VKDB happens after the first week of life, usually during weeks 3 to 8, but it can occur anytime in the first 6 months before infants begin taking in vegetables. The bleeding usually happens in the brain, skin, or digestive tract. Bleeding in the brain is often the first sign of late VKDB, and this can happen in infants exclusively fed human milk who did not receive supplemental vitamin K. Some infants may also be at higher risk if they have undetected gallbladder disease, liver disease, or if they have cystic fibrosis, chronic diarrhea, or are on antibiotics. So for as long as people have been writing about birth and babies, we've known that this type of bleeding exists. But scientists did not always know what caused it.